So our presentation is going to be on fecal microbiota transplant.
I'm Azine.
I'm Shiley.
I'm Kyle.
And I'm Moriel.
What is FMT? FMT is a fecal microbiota transplant, also known as a poop transplant. FMT is the transfer of fecal matter from a person with a healthy microbiome to a person with a damaged or ill microbiome. Fecal matter contains remnants of microorganisms which are able to replenish in proper conditions.
When is FMT used? C. diff is a germ that causes severe diarrhea, nausea, fever, loss of appetite, and inflammation of the colon. Many people have C. diff in their bodies without any issues, but under certain conditions, the bacteria release toxins that create these symptoms. It can infect anyone, but most cases occur during or after an individual has taken antibiotics. It causes 500,000 infections in the US per year, and 1 in 6 C. diff patients will get it again in the next 2 to 8 weeks. FMT is most effective at treating C. diff, and the vast majority of patients will be cured of recurrent infections with a single treatment. I mentioned in the last slide that many people have C. diff in their bodies without any issues. The top part of the image shows the asymptomatic colonization of C. diff in the body without any symptoms, and the bottom depicts what occurs when certain risk factors cause the bacteria to release toxins.
C. diff is very hard to cure as it is extremely resilient in many cases, resistant to bacteria, resistant to antibiotics. When antibiotics are prescribed, rather than reducing the C. diff population, they may backfire and rather clear out the good microbes, thus creating more room for C. diff to colonize additional surface area. FMT is used to reintroduce a healthy ecosystem of microorganisms that are able to outcompete the damaging overpopulated C. diff, essentially curing them.
FMT has been used to treat and is currently being studied to treat many other conditions such as Crohn's disease, ulcerative colitis, depression, obesity, Parkinson's, and even cancer. In a study done by Dr. Jonna Jelenka in Finland, patients who underwent FMT for digestive issues had significantly faster improvement in their bowel habits, less irregular bowel function, and less gastrointestinal tract symptoms such as diarrhea, cramping, and constipation. The results also indicated that improving digestive health additionally improved the patient's mental health.
While FMT is overall a very safe procedure, there are potential side effects and risks. Many of the potential risks are mitigated by implementing a careful selection and screening process for prospective donors. These would include obtaining a detailed medical history together with testing for a wide panel of infectious disease. Many centers follow a universal stool bank model distributing pre-screened frozen FMT preparations. Side effects of FMT are mild, self-limiting, and include transient diarrhea, abdominal pain or cramps, bloating, flatulence, and constipation. Risks of FMT are usually avoidable through proper regulation, yet they are not fully eradicated. FMT is riskier than probiotics because probiotics contain relatively few well-defined strains and can be grown in pure culture. This significantly limits risks and contrasts with FMT, which involves thousands of bacterial species. Transfer of live microorganisms to recipients with underlying illness presents a greater potential risk. However, a growing number of studies have shown FMT to be well tolerated in higher risk patient groups. There is also risk due to the method of administration, such as intestinal perforation and physical injury. In rare cases, some people have experienced intestinal perforation that can be very dangerous and life-threatening. Physical injury due to enema, colonoscopy, and nasoenteric tube may cause injury when inserted for treatment. The transferring of a parasite or pathogen can occur when dangerous bugs or viruses are passed through FMT. This risk can generally be avoided with proper screening. Dysbiosis or unbalanced gut microbiome generally avoidable with proper medical screening, but if the donor is not of the utmost health and or has an unbalanced microbiome, this might worsen dysbiosis in the recipient of the sample. Cases of FMT failure and future potential risk. There have been some recorded cases of FMT failure, and a recent example is the acquisition of ESBL producing E. coli from donated stool. Whole genome sequencing of donor and recipient strains identified that the source originated from donor feces. This resulted in bloodstream infections in 2 patients and 1 death. In a similar event, 6 infections caused by EPEC and STEC have occurred following investigational use of FMT. 2 deaths in patients with chronic underlying health conditions were reported, although it is unclear if infection contributed to the deaths. Future risks of FMT failure include COVID-19. This virus can be found in GI tracts, so presumably could be transmitted via FMT. And there are theoretical possibilities of increasing the risk of certain non-infectious conditions in the recipient. These include a vast range of illnesses such as obesity, insulin resistance, and other metabolic disorders, cancer, mood disorders, and other neuropsychiatric conditions.
Okay, so I'll now be describing the mechanism behind fecal microbiota transplantation. So if you direct your attention to figure A, you can see how a background microbiota that lacks diversity can cause an increase in free nutrients and acids that can allow harmful bacteria such as C. diff to proliferate. And when this occurs, it can lead to an increase in sporulation and secretion of toxins that can damage the epithelial cell wall. So basically, in figure B, you can see that when an FMT occurs, it can add diversity to the background microbiota, which can cause there to be more bacteria that deplete the free nutrients and the acids that the harmful bacteria use to grow, thus reducing sporulation and the toxins that they're able to secrete because they aren't able to grow as well. And figures C and D also show the same mechanism, just generalized to normal pathobionts, not just C. diff. So I'll now take the time to discuss some of the novel and prospective research that's ongoing regarding FMT. So as was mentioned earlier, fecal microbiota transplantation is relatively safe. However, there's still some risk involved due to our uncertainty regarding exactly what the microbiota composition of the traditional fecal transplant is. It can lead to possibly life-threatening infections, and that was discussed earlier. So in order to avoid the possibility of this, some researchers have begun investigating whether synthetic stool can be appropriate alternative. And this synthetic stool is a mixture of 33 different types of bacteria that are created in this machine termed the RoboGut. And this machine basically simulates the environment of our colon and is used in creation of the synthetic mixture. And this synthetic stool is already proved to be helpful in a lot of the C. diff cases that we discussed earlier. However, more research is still needed to see if this is an actual valid alternative for other diseases that FMT can treat. Okay, and some of the future research that's ongoing. And so basically over the years, there's been an increase in the acceptance and uptake of FMT as a valid and cost-effective treatment for various diseases involving the immune system in the gut. And FMT works well for the diseases that we know are linked to the microbiota. But again, we don't know if a lot of diseases are linked to the microbiota. So this is kind of where the future research is going, and it's trying to determine whether the microbiota basically is linked to other different diseases. And if our microbiota are shown to play key roles in the pathophysiology of diseases, it could prompt FMT to be evaluated and determined if it is an appropriate treatment for these diseases. And the role of the gut microbiota is currently being analyzed in diseases such as necrotizing enterocolitis, liver disease, colorectal cancer, and even autism. And in addition to this, there's been many observations of patients being treated with FMT that have noted improvements in conditions that are seemingly unrelated to the microbiota in our gut. And an example of this is something like a peanut allergy. There's been some stories of FMT actually helping with that. And so basically this could lead to FMT being used as a treatment for a host of conditions that were never previously expected. But again, this can only occur when further research is done. So this is where some of the research is going in the future. And this is our references for everything. And yeah, that should be it. So thank you guys for watching.